committed to you. Fox 10 News.
Welcome back to Fox 10 News at 4, and thank you for staying with us. You know, new research is bringing fresh hope to a new kind of treatment for patients with glioblastoma. This is after identifying a way to stop the growth of this life-threatening brain tumor. It's the same kind of tumor diagnosed in U.S. Senator John McCain. He says it took 5 days after doctors removed a blood clot over his eye to confirm he had glioblastoma. So we have Dr. Clayton Smith here. He is a radiation oncologist at USA Mitchell Cancer Institute to talk more about how local doctors are treating this, and also, you know, what the promise is looking forward. So I want to go back to glioblastoma. That's the diagnosis itself, correct?
Correct.
Okay, and the cancer is?
A glioma, so that's a type of primary brain tumor, so it starts in the brain. And it's really sort of the tissue that holds the brain together. So it's sort of glue. That's where the glio comes from. And so for brain tumors, we really stage it by the grade. So how aggressive does it grow? And so glioblastoma is a grade 4, so the most aggressive.
Okay. So when a person hears that diagnosis, you know, obviously there's some concern, but we were talking about hope. Can you elaborate on that part of it?
Right. Well, first I start with the treatment, because I really try to impress upon patients, take things one day at a time, one step at a time, because if you just sort of look at what you read and what you hear, it definitely it's hard to find hope there. So the treatment itself is usually the surgical resection or biopsy, and then that's followed by radiation and chemotherapy. And that treatment's actually pretty well tolerated. So most patients get through that pretty well without much in terms of nausea or sickness, just a little fatigue.
How long does it take? I mean, in that case with the senator, it was 5 days just to remove the clot. Is that typical, or does it depend?
Right. So what that's referring to is really sort of the time from they went in to remove the clot to get the pathology back to say this is what the diagnosis of glioblastoma is. And then the treatment usually starts within 2 to 4 weeks from there. It goes on for about 6 weeks.
Okay. What can we see looking forward in terms of, you know, clinical trials and other types of treatment?
Right. So we've been treating with chemotherapy and radiation for this really for about 10 or 15 years. That's sort of been what we call the standard of care. So over the past several years, there's been new treatments called tumor treating fields, or actually electrical therapy, where patients sort of wear a cap over their head. That has been demonstrated to actually improve survival. And then current ongoing clinical trials are actually looking at adding on sort of targeted therapy to the radiation, as well as adding on immunotherapy to sort of allow the patient's body to sort of attack the tumor with its own immune system.
And we were talking before we came back, and you said this isn't the only type of cancer that you are well versed in. You also, you know, help people with others.
Correct. So I also treat gastrointestinal cancer, so that includes rectal cancer, pancreatic cancer, and GU cancer, so that's prostate, bladder cancers as well.
Is it fair to say that one is harder than the other?
No, I wouldn't say that. I mean, certain treatments are definitely harder to get through, depending on the place in the body, and obviously certain cancers have better prognosis than others. But I think for all patients, when they kind of come to us to discuss whatever their cancer is, they all share the same fears.
Okay, well, I thank you so much for coming in and sharing this. Hopefully it will ease some fears. I know there's a team approach at Mitchell too.
Absolutely.
All right, well, thank you so much, Dr. Clayton, for coming in, and we'll have all of this posted for you on our website, fox10tv.com, so you can watch it and share it with someone you know. Look for it shortly on our website.